Hello, everyone. This is Dr. Richard Fleming. Today is Thursday, the 21st of January, 2021. During the last couple of days, I've taken an opportunity to release some information on videos discussing vaccines and the potential complications and already noticed complications that are being seen with the Pfizer and Moderna vaccines and the concerns that we have for the Oxford AstraZeneca vaccines. As many of you are familiar with what's going on in the media recently, today's notification from County of Santa Clara shows that the County of Santa Clara has placed a pause on administering the Moderna vaccine from at least the one specific lot number where it's been noticed to have a considerable number of complications. I realize that for many individuals, the promise of the vaccine has been what has been proposed as the answer to SARS-CoV-2 or COVID-19. While many have been promoting the vaccines, others have been discussing the use of different medications as shown in this little graphic here from the New England Journal of Medicine. And this particular topic raised concerns about one of the medications being used for COVID-19, tocilizumab, which is an interleukin-6 inhibitor. The problem with many of the studies, and the reason why hope seems to be fading for so many people, is that many of the studies only look at one drug and one drug alone. As I've emphasized previously during the last couple of months, there are treatments available for SARS-CoV-2 that work. A vaccine is not a requirement and probably should never have received emergency use authorization given the fact that we know that there are treatments that work. But the treatments that work for this virus, SARS-CoV-2, are much like the treatments that exist for other viruses. It requires more than one drug to have the beneficial effect because we not only now have to address the inflammation and blood clotting associated with these viruses that are killing people, but we also need to work on treatments that inhibit the virus from attaching itself to your cells and replicating itself. The good news is that there are a number of medications that do this. And while I've been hesitant to discuss too much about our research findings, because as a research physician, it's contingent upon me to actually get the papers published first so that I don't run the risk of losing the ability to get the information published and out to my medical colleagues. I do want you to know that there are several medications that work for the treatment of SARS-CoV-2. Tocilizumab by itself was not successful, although tocilizumab combined with another medication was extremely successful, greater than 99% of the time, in individuals who had this inflammation and blood clotting. There are a variety of medications that have been shown not only by myself but others to be beneficial and useful. And these include medications like hydroxychloroquine and primaquine that interfere with the attachment of the virus and its ability to replicate or reproduce itself. Many of you have also heard of the drug ivermectin, and those who propose using ivermectin believe that they have information that shows that it interferes with the ability of the virus to attach and replicate itself. While many people talk about the use of antibiotics for this virus, it's important to realize that what we're not doing is preventing a secondary bacterial infection or a bacterial infection, for example, a pneumonia, that occurs following the virus. But these drugs are very useful for interfering with the virus itself. Please stay tuned as we wait for the opportunity to release more of this information to you. In the meantime, if you have a physician or a medical center that wants more direct information from myself, I will be happy to provide to them the information about the treatments that we have that we've shown that work, as well as any other additional information that they need. The raw redacted data on all of this study will be available for the individuals that are working in the scientific field doing research on SARS-CoV-2 or physicians that are taking care of SARS-CoV-2 patients. That's 1,800 patients over an 8 to 10 month study looking at the different treatment effects of a variety of medications and the effect that they have on the virus so that your healthcare provider and your hospital system can more correctly target and address SARS-CoV-2, stopping the virus in its tracks, preventing people from having an inflammatory and thrombotic response, decreasing the harm and the deaths resulted from this virus. While the vaccines are showing the concerns that many of us have worried about, hope is in the treatment, knowledge and answers are in the treatment, and those treatments are available. And I will be happy to speak to the appropriate individuals that step forward requesting that information. I will make available to them the research results privately as we wait for the journals to publicly release the information for the scientific community. Thank you so much. This is Dr. Richard Fleming. Today is Thursday, the 21st of January, 2021.